Three poverty-stricken hospitals in Brooklyn, Brookdale, Interfaith, and Kingsbrook have now been put under one system to provide improved health care to all the communities they serve. This new health system is called One Brooklyn Health System. Joining me to discuss this are LaRay Brown, CEO for Brooklyn Health and Interfaith Hospital, and Dominick Stanzoni, Chief Operating Officer at One Brooklyn Health and CEO at Brookdale Hospital. Well, welcome to Brooklyn 45.
Thank you.
Thank you so much.
The question so many people have been asking, what is this One Brooklyn Health?
Sure. So One Brooklyn Health is the coming together of three essential hospitals in Central Brooklyn, that serve Central Brooklyn and North Brooklyn. And what I mean by coming together is that there ultimately will be one board that will govern these three hospitals. And importantly, there'll be a significant investment of resources to create more outpatient services, to make improvements in the buildings, the physical plants of these three essential hospitals. Example being to improve the inpatient intensive care unit at Brookdale, to make the Kingsbrook Jewish Medical Center into more of a medical village, moving away from inpatient acute care, more to outpatient and long-term care, and Interfaith being your basic bread and butter community hospital. The idea of a system is not new. What is new and what's really exciting is that, as you said, these three hospitals that have served as safety net for the Brooklyn community and that have, in fact, been poverty-stricken, are being given an unprecedented opportunity with the state for an infusion of funds and for us to redesign how healthcare is delivered in Brooklyn.
You said infusion of funds.
Yes.
Has it been financial that's been the problem, or services that's been the problem?
I would say that, as they say, with no money, no mission, right? So because these three hospitals have traditionally served a significant percentage of Medicaid patients and uninsured patients, we have struggled financially because we don't have the opportunity of commercially insured patients to cross-subsidize the resources of those public insurance programs. So the limitation of our finances has resulted in our being unable to make investments in our physical plants, as well as investments in expanding services and access, and particularly in terms of outpatient care.
That sounds like your responsibility, Mr. Stanzoni.
Yes.
Stanzoni is correct.
Yes,
right?
Stanzoni.
That sounds like your responsibility. You're the COO.
Right. So the exciting thing here is that this is an opportunity to bring care into the communities, right? Hospitals are important. They're very important. But one of our goals is to keep folks out of the hospital, right? To provide those primary care services to keep them well, to make sure that they have access, children have access to all of the preventive care that they need. We don't want folks coming into the hospital. We want to keep them out of the hospital. But this investment is going to allow us to do that, but at the same time to upgrade our hospitals so when folks need to come, we'll be able to provide them with the kinds of services that they really require and deserve.
You probably don't want to talk about this, but how bad have the hospitals been in terms of condition?
I will give you an example. In Interfaith's parking lot are two temporary chillers that have, since April, May, have cooled the hospital because our HVAC system is really not functional. So we've had to spend money to make sure that we're providing safe and comfortable care. And therefore, that money that we're using to rent these temporary chillers could have otherwise been used for something else. So the investments, that's just one example of an investment of that the patients won't see necessarily, but that they will feel, right? That will enable us to provide, as I said, safe and comfortable environments. But we have things like an emergency room that's too small at Brookdale that we need to expand. Because while we want to move our care more into the community, there are still situations in which there are crises and emergency services that need to be rendered. We have things like at Kingsbrook, as well as Interfaith and Brookdale, elevators that are old and aged, and it is incredibly important to be able to move people up and down when you're operating a hospital. But as importantly, we have existing outpatient centers in the community that need to be invested in terms of capital for improvement of those environments, and moreover, expanded capacity. So we're anticipating funding to be able to do all of those things. And as importantly, we are a technology-driven society, and healthcare is very much technology-driven to afford the doctors and nurses to provide efficient and effective care. As hospitals that have not had the kind of resources that some of the richer hospitals or richer systems have had to invest in electronic medical records or other information technology, we are hopeful that we'll be able to have some funds to do that, and therefore using that technology to really truly work as a system, so that if I were to go to Interfaith and in the emergency room, for example, one, I'd have an electronic health record where the staff don't have to ask me the same questions for the 16th time. But moreover, if I need something beyond that emergency room visit that Interfaith doesn't provide, but that Brookdale does, we'll be able to seamlessly provide information about me to the surgeon who may be waiting for me at Brookdale.
What communities would these hospitals serve?
So essentially Central Brooklyn and Eastern Brooklyn. Right? Those are the traditional service areas for these.
What's Eastern Brooklyn?
East New York.
East New York.
Okay.
Right.
Brownsville.
Okay.
The other neighborhoods are Bedford-Stuyvesant, Crown Heights, Prospect Heights, East Flatbush, Flatbush. Again, Central and Northeastern Brooklyn are huge in terms of not only the geography, but also the number of people who live in those communities.
And there aren't other services there to provide for. So that's why this is so important, because the not just the survival, but the thriving of this institution is critical to the communities. There's a lot that needs to be done, but I'd also like to say that there's a good foundation we can build on. Mm-hmm. We have great staff. We have very committed staff, committed physicians, nurses, staff at every level. And while, in spite of all of the financial challenges, there have been investments made. At Brookdale, there's a level 2 trauma center that serves the community. There's a cancer center there at Brookdale that serves the community. So, and much of that has been the commitment of the boards of these institutions, but also the elected officials. The elected officials have made sure that where they could, they would make investments or find money to invest in these communities.
And we've enjoyed strong partnership with labor, 1199 and NISNA. They've been stalwart supporters of these hospitals, and in joining, as Dominick said, in joining with the elected officials, really advocating and realizing additional funding to keep us open. Right? But now, as was said, we want to thrive, and we also want to make sure that we will be around for the next century for our communities. Brookdale, Interfaith, and Kingsbrook enjoy decades of being in those neighborhoods. Mm-hmm. And even as those neighborhoods have shifted from a demographic perspective, they continue to be essential healthcare providers.
Why were these 3 neighborhoods selected?
Principally because the healthcare ecosystem has had significant financial challenges, and there have been ongoing threats for the closure of any one or another of these hospitals. But also because these communities are communities that have significant and significant prevalence of conditions that can be prevented with healthcare and with the right types of healthcare services. So, as an example, Brownsville, Bedford-Stuyvesant have disproportionate prevalence of heart failure and diabetes and HIV illnesses when compared to other parts of Brooklyn, like Park Slope, or other parts of the New York City, like Lower Manhattan. So it was recognized and by our elected officials, by the state officials and others, that we have to have a critical investment in these communities if we are going to make a difference in the lives of the people who live in these communities.
Did complaints from the people who live in the community contribute to the decision for this One Brooklyn Health?
Well, I would say complaints. I would use the word the advocacy.
Right.
I mean, was a righteous amount of advocacy on the part of folks at Interfaith well before I got there, and that community came together. The people who worked at Interfaith, the consumers of who use Interfaith, people who live in the community, our elected officials, folks from the institutions like Medgar Evers and other organizations who. Small businesses, all of whom understood and appreciated that that hospital is not just a place to provide health care for the sick. It's an institution that supports the wellness, the economy of that community.
Right. Hospitals are large employers also, so we have a great economic benefit on the community. And when institutions like that begin to wane, the neighborhoods around them suffer. Right, because businesses don't do as much business, and there's less employment. One of our goals in building this new system is to be able to have that be somewhat of an economic engine for the community, to use local builders, to use to buy services from folks into the community. We've been meeting with local suppliers as we move these programs forward to make sure that, yes, this is a great promise for healthcare, but it also can be an economic benefit to the community.
What kind of relationship do you have with other institutions in the community?
Well, we have I'll just use Interfaith as an example. We have a strong relationship with Medgar Evers in terms of their programs, in terms of social policy, etc. Actually, just this summer, we engaged in a participatory action research effort that was started last year in the Brownsville community with our Brookdale colleagues and Medgar Evers, in which we engaged high school students, college students, seniors to actually go and talk to people who lived in those neighborhoods and ask them about what's important to you in terms of your health. And it's remarkable because most times people don't say a hospital. And in fact, we're going through the data that was collected this summer. But what I've learned from the preliminary findings is in the Bed-Stuy, Crown Heights, East Flatbush communities, which were the focus this summer, many people are talking about the issue of feeling as if they're being pushed out, displacement, challenges in terms of affordable housing. Those are as important as the availability of healthcare services, right? So, or the availability of affordable, healthy food. And I think that's another important aspect of One Brooklyn and the 3 hospitals that comprise the One Brooklyn system. We are community hospitals. We have a tradition of being engaged in social justice issues. We've not created a moat around ourselves and only said we're only going to see the people who can pay. We've been committed to providing care to our communities and addressing the needs of our communities beyond the walls of the hospital.
One Brooklyn. But this One Brooklyn is only in a section of Brooklyn where the population is mostly my complexion.
Our complexion. But, increasingly more diverse. Frankly, Interfaith is on Atlantic Avenue. And when I leave Interfaith at 8 or 9 o'clock at night, I see as many people of our complexion as in other complexions. The communities have become very diverse. We have a core patient population, but we're also, again, if we want to be a healthcare entity for the future, we absolutely need to make sure that we are responsive to the needs of the changing communities as well.
And to your question about partnerships in the community, Each of our hospitals is part of an effort called Community Care of Brooklyn, which comes out of the Medicaid redesign program for the state of New York. We are members of that, and there are 200 community-based organizations, mostly focused in central and northeast Brooklyn, 4,000 physicians. They include social service agencies, housing agencies,
mental health providers,
the federally qualified health centers. So
what is a Medicaid redesign?
Well, several years ago, Governor Cuomo, during his first term, created a Medicaid redesign team that was their goal was to identify opportunities for how Medicaid could, the expenditure of Medicaid could be reduced, but at the same time, investments being made for those people who have the greatest needs. And the state of New York applied for and received funding from the federal government to match its investment to redesign some of the services throughout the state. We happen to be part of the group that's focused on Medicaid redesign in central Brooklyn, central and northeast Brooklyn. But the investments from that initiative are for things like providing care management services, providing health coaches, the sort of making investments that hospitals necessarily don't have the wherewithal to do, but those services support the whole person and enable people to live healthier lives.
And take into account the other things that LaRay referred to, the social determinants of health, right? Where someone lives, what they eat, avoidance of crime, things of that nature. So all of these organizations are working together towards those goals.
One Brooklyn health system. Where do we go from here?
Well, we're excited about where we go. We're anticipating a significant capital grant from the state. We're hoping to hear from the state about that grant so we can begin to make those investments that we talk about. We are already pulling our physician leadership together so they can begin to identify how they might change, even how their departments are organized to better serve our patient population, but to do things more efficiently. And I would say the most critical thing about One Brooklyn is we are no longer three hospitals competing for the penny. We are a system, and so that penny is shared by all of us, and we need to figure out how we can most effectively and efficiently use that penny to better serve our community.
And not just trying to survive, but making sure we make a difference for that community.
One Brooklyn health system, and the Brooklynites are going to benefit from this, I'm sure.
Absolutely.
Absolutely.
I want to thank you for being my guest on Brooklyn 45.
And we thank you.
And I look forward to having you again to talk about the progress that we expect you to be making for these particular neighborhoods that we've discussed.
We'll be excited to do so. Thank you.
Absolutely.
My next guest, Tabitha Boney, is a teacher and pastor who recently decided to homeschool her 5-year-old son. Tabitha, welcome to Brooklyn 45.
Thank you.
Why did you decide to homeschool your son?
Well, it was after much thought and many years. I have quite a few sons, and so this is my last son, and I decided that I would do it with him, but it's always been a desire. And so this year I just really decided that I was going to do it. I feel that God really needed me to take this time to really pour into him. Not only academically, but also spiritually, that I should be teaching him how to pray, how to worship, and, how to live according to the scriptures, which, I'm a Christian, so that's what my goal is.
How many other children?
I have 4 total, 4 sons.
And what was the dissatisfaction with them, the way they were schooled?
Not necessarily, well, okay, being a teacher and being in the school system, I'm privy to certain things that go on in the school system with the overcrowding of the classrooms and the teachers really not being able to give adequate time to each individual student. And so while I was teaching, I actually had my son in the same school. And for this particular year, he really did poorly in literacy, and that really hurt me because I'm a literacy teacher. And so while I was teaching other people's children, mine was not being taught. And so that summer, I had to spend the whole summer doing catch up with what he should have already gotten in the 3rd grade. And so with my youngest son, I wasn't necessarily dissatisfied with the education that he was getting. However, I was dissatisfied with the time that he was in school, from 8 o'clock to 4 o'clock. That's 8 hours. I personally think that's too much, and he was in kindergarten. 8 hours in a classroom, too much for me. So only time that I really had to pour into him was the time between homework and dinner, which was not much time. And after that, they have to hurry to bed, so I'm really not getting a lot of time to pour into him like I wanted to.
You're going to have enough time now.
Yes, absolutely.
What are you excited about?
I'm excited about just like the conversations that we have. I'm really able to give him so much more than I was before, like just the conversations we have about police officers and, you know, about the Word of God, and just being able to, like, in the middle of the day, just hug him. You know, when he's somewhere else, I can't do that. I don't know what's going on with him. And so to have him there with me is just an awesome thing. Like, I know where he is, I know what he's doing, and I know that he's being taught and cared for.
He's 5 years old.
6.
6 years.
Yes.
You're going to be educating him for how long?
That I don't know. I just committed to the year because that's what I was hearing that I needed to, you know, at least give him this year. Next year, I don't know.
How are his grades evaluated and credited?
Well, okay, so I'm new to the process, so I'm still finding out different things. I know that they're going to send me some type of packet that I fill out to say, I guess, where he is now. And so quarterly or within a couple of months, I send an update as to what he's doing. And that's how they'll...
So you send the updates to who?
To the New York City Department of Homeschooling.
Oh, there's such a department?
Yes.
Oh.
Yes.
Okay.
There's a homeschooling. Yes. And it's New York City Homeschooling Department, Office of Homeschooling, that's the correct name, Office of Homeschooling, yes.
What challenges did you face developing a relationship between you as the instructor, as a homeschool instructor, and them as an organization?
Well, like I said, I'm still in the process, and so right now, okay, so the process is that if you know before the school year starts that they have a July 1st deadline that you're supposed to send a letter of intent. And so in July, I wasn't sure still. So I waited till the semester started. And if you do it that way, you have to send in a letter within 2 weeks. So within 2 days, I sent them a letter, and the process is they send me a packet back that I have to fill out to send it with them. And so far, like, I've been calling, like, I emailed and I got a response. But as far as calling, I can't reach them. They're never available, and the mailbox is full. So we'll see how that turns out.
So you're a teacher in the school system.
Yes.
And you're also the teacher at home.
Yes. Well, I am no longer teaching in the school. I resigned.
Oh,
yes.
Okay. And you're now the teacher of just your son.
Just my son.
So you know exactly what he deserves.
Yes, absolutely.
Okay. So who sets the standard?
Well, I set the standard.
You set the
However,
standard. Yes.
there are Common Core state standards that I need to make sure that he's reaching and covering certain standards. Yes.
So how do you balance work chores while homeschooling?
Again, I'm new, so I'm trying now to figure out a system to balance, but I have had at least one individual speak to me about co-oping, which is when one parent homeschools and another parent homeschools, we could kind of swap kids like for a day or so. So she'll do the instruction one day and I'll do the instruction the other day so that we have time to run errands and do other stuff that we cannot do.
Which do you prefer? Homeschooling at home or in the school?
Well, I guess for my children, I would prefer homeschooling.
Yes. And what kind of relationship do you have in terms of comparing the academic progress, those who are in the school and those who are homeschooled? What's the conversations like? What's the comparisons like between the two groups?
Well, for me, because I've taught this grade before, and for a number of years I've taught first grade, I kind of know what they're expected to reach by the end of the year. And so some of the things that they're expected to reach at the end of the year, he's already reached. So it's just a matter of finding his interest and making sure that providing instruction in those areas.
So you create the curriculum, but
Yes.
based on the curriculums the curriculum that you had used in the past.
Right. So part of it is a curriculum that I already had and that I used effectively in the classroom. Another is a pastor friend of mine who also created a curriculum. And so this is for like vocabulary instruction and grammar. So I have some secondary resources as well.
Tabitha Boney,
Yes.
you're one in a million.
Bless the Lord. I receive. Thank you.
Yes, well, you're a pastor as well, so you give blessings as well. And I'm sure the Lord spoke to you and said, Tabitha, you should do this.
Yes. Yes.
I want to thank you for being on Brooklyn 45.
Thank you for having me.
And thanks also to LaRay Brown and Dominick Stanzoni for information about Brooklyn, the merging of hospitals in Brooklyn that will benefit so many communities. For people you know who may have missed this program, or if you want to see it again, it's on our Brooklyn 45 TV YouTube page. We'd love to hear from you. Post your comments on our Facebook page, Brooklyn 45 TV, or email us at brooklyn45.com. On behalf of our entire Brooklyn 45 team, I'm Sam Tate.